Hi again. Okay, I'm continuing on this whole topic of autoimmune diseases and how to prevent and cure them. If you're new to this series of posts, please go back and check them all out from the beginning because they all kind of work together and build on each other. And in that way, you can prevent yourself being one of almost 25% of the American population who either has an autoimmune disease or is going to come down with one. That's a huge epidemic and nobody's talking about it. And I don't want you to get sick from these diseases when they're 100% preventable. And for the most part, they haven't gone on too long, curable if you get rid of the causes. So today I'm going to talk about heavy metal toxicity, specifically two heavy metals. That's going to be aluminum and mercury. These heavy metals are connected to autoimmune diseases. I've talked about this in the past. And so I want to spend a little time talking about how do you know if it's a problem for you, and then what do you do about it if it is a problem for you. Okay, the best way to screen for aluminum and mercury toxicity is with a test called the UPPA. UPPA, that stands for Urinary Porphyrin Profile Analysis. This is a test that's done by all the major laboratories, and it looks at a series of enzymatic steps on a particular enzyme system called the porphyrin system. And the reason this is interesting is because aluminum and mercury and lead and some other heavy metals and a lot of other toxic materials like pesticides and such will interfere with certain of those steps. And by looking at that profile analysis, you can have a pretty good idea if mercury is playing a role in an individual or if aluminum toxicity is playing a role in an individual. So a UPPA test, it's easy to do. It's a urine test. You just wake up in the morning, you collect the urine specimen, you got to put these porphyrin molecules that the lab's going to be measuring are very sensitive to sunlight or light of any kind actually. So you put it in the container and wrap it with aluminum foil and then put it right in the fridge right away so it's not getting exposed to light and it's staying cool. And then get that down to the laboratory pronto and have them check you out for that. And that's the best way to screen for this. Now, if you look at that and it appears that there's a good likelihood that you have aluminum and mercury toxicity, go back in the previous post. I talked about what the sources of that toxicity is, and of course get rid of the sources. But the point is this, there are two good treatments for aluminum toxicity. One is intravenous EDTA therapy. That's kind of my favorite. Another one is deferoxamine. That's another medication type of treatment that can pull aluminum out of the body. And you might, if you go online, you can see where people are claiming that malic acid and or citric acid can be helpful to pull aluminum out. But keep in mind, the only thing that indicates that those natural substances that can pull aluminum out are some what we call in vitro studies, that's test tube studies. There's nothing out there that indicates that you can clear out the aluminum heavy metal with those substances. So for me, I go straight to aluminum chelators like EDTA or like deferoxamine and call it a day and get rid of it that way. To find a doctor who's trained in that kind of thing, you can go to this website, www.acam, American College for the Advancement of Medicine, acam.org. And doctors in there know how to chelate out aluminum and also other heavy metals. Now, the best treatment for a mercury toxicity is a pill called DMSA. And DMSA, you can get this, I think it's regulated. I don't think you can just get it online, but it's real easy to take. It's just a pill. And the one thing I want you guys to understand is in order to get rid of heavy metals, it takes a long time. It's not quick. You can take the DMSA in the case of mercury, you can take the other treatments in the case of aluminum, and you can be doing those treatments easily 4 to 6 months before you normalize out the UPPA test, before you pull out enough of these heavy metals in order for you to regain your health. So be patient. It takes a long time. Detoxing from heavy metal toxicity is a very slow process. So start it, get it rolling, and then about every 3 to 4 months, check that UPPA and keep doing it until you see the UPPA test is pretty close to normal, and then you know you're clean and it's time to stop that particular procedure. Okay, so thanks for listening. And if you want to know more, of course, please put a comment in on my bio. And if you know anybody that could benefit by learning from this kind of information, please forward it over to them. Okay, thanks.